Everybody's probably familiar with inflammation. For example, if they get a cut, they see it turn red, it goes warm, etc.
Yes.
Inflammation, though, has a range of conditions or chronic forms that we may not be familiar with. What are some of the conditions that have inflammation as a cause or as part of their effect?
Yeah, so inflammation is now recognised to be a part of many, many different conditions and diseases. And some of this has been known for tens of years, some of it is more recent. So we have diseases like arthritis, which you would call a classic chronic inflammatory disease, where it's been well known that inflammation is occurring in the joints, that damages the joints, it's visible, and it's clear to the patient themselves because of the swelling and the pain and the inability to move and so on. So that's one type of inflammation that's long recognised, and that's treated with anti-inflammatory drugs. You have similar types of inflammation, for example, in the gut, in inflammatory bowel diseases, in the skin with psoriasis, in the lungs with asthma. So these are really classic inflammatory diseases that are known to respond to anti-inflammatory drugs. And of course, they cause illness and a patient knows they have these inflammations. But now we know that inflammation occurs at times and in places that the person doesn't really realize. For example, within the blood vessel walls, you can have inflammation as part of the progression of heart disease, for example. And it's now well recognized that heart disease has an inflammatory component, as well as the other components that we already knew about. Even obesity is now recognized to have inflammation, at least associated with it. Whether that's a causal association, in other words, inflammation is pushing obesity forward, or whether inflammation results from obesity isn't clear yet. But these are the sorts of things where there's a sort of a silent inflammation that's now recognized to be important.
And do you think increasing omega-3 in relation to inflammation can not only improve the length of a person's life, but also the quality of those life years?
Yes, I guess the first thing would be the quality of life. So where you can treat somebody with arthritis with omega-3s, then they will see over the period of that treatment, obviously, an improvement in their pain, improvement in ability to be mobile, maybe able to go to work when they couldn't before, and so on. So that would be a much improved quality of life. But in addition to that, inflammation can increase risk of cardiovascular disease, even in people who have other diseases apart from just cardiovascular disease. And ultimately, of course, that's a cause of mortality. So I think by decreasing the inflammation, you can decrease mortality as well. So I think it's a double hit, both the improved quality of life and the increased or the longevity improvement.